We were having about 700 presentations a day to ED, so 700 patients through the door. And with that, just a really big change in acuity. So, resus would be full all day with intubating people and just back to back. All of this stuff, it was like, oh my God, we are drowning.
There is rarely a life untouched by hardship or challenge. On this podcast, we invite our guests to share their very personal stories. We harness the wisdom and resilience of our guests, which has shaped who they are today.
Carl Rogers said, "That which is most personal is in fact most universal. Together we'll be inspired to embrace the resilience in our own stories and to gain strength in the face of adversity and have a few laughs along the way."
Hi, I'm Donna.
And I'm Di. We are the Double Ds and welcome to the Discovery Diaries.
We acknowledge the Whadjuk people of the Noongar Nation as the traditional custodians of the land on which we are recording this podcast. We pay our respects to the elders past and present and acknowledge their spiritual connection to family and storytelling.
Both Donna and Di were born here on these lands. We are grateful to draw on the culture of telling and sharing stories, and we hope that you will draw inspiration from the stories that are shared here. Today we're going to be having a really great, fun, fast-paced conversation with Emily Regan, who is a Curtin graduate in nursing. She is a registered nurse and she moved to London after falling in love with the city when she was on a holiday a few years earlier. After completing her degree and graduate nursing year in Perth, she set off, never imagining some of the experiences that she would have. Emily was working for the National Health Service in central London in a hospital when the COVID-19 pandemic began. But she decided to stay and continue to work, unlike others. And during that time, she had the opportunity to speak out about her experience, and she's going to tell us how that happened, which remarkably led to her being invited by the Australian government to be a representative at King Charles III's coronation. We're going to hear all about that and lots of other funny stories. It was a wild ride. We hope you enjoy it as much as we did. So, Emily, lovely to have you here, all in black. Our listeners can't see you, but we've just been having a chat online about the wonderful properties of wearing all black.
It's my standard uniform.
So here we are at Curtin in the little podcasting studio here. Has it been a while since you've been back at Curtin? Because I understand you used to be a student here.
Yeah, so I was here, oh God, when did I graduate? I think 2015, and I haven't been back since, so nearly 10 years.
Oh, wow. Yeah. Is this your first time on campus?
Yeah,
Oh.
I think, I was trying to recall and I was like, I don't actually think I've been back.
Okay. Well, probably lots changed.
Yeah, so much. I drove past the other week and my mum used to work here as well, and I was like, oh my God, there's so many new buildings. And she's like, it's huge. She's like, it's huge. She's like, we'll have to go get a coffee. And I was like, why, Mum? Like, I was like, what? She's like, you can see it all. And I was like, okay, yeah, we'll go do that. So I'll explore it all.
Well, we've not met before, Emily, but it's great to have you here.
Thank you.
But I do know that you bumped into Donna, I think, at a party or something.
Yeah, that's right. It was really interesting because we didn't really have any podcast guests lined up. And I thought, I'll go to this party. I was going to go anyway, but I went on my own. I didn't really know anyone except for Orla, who was 30 on that day, and her sister. And I just thought I'll go along and I might meet someone we can have on our podcast. And there you go. The first person I had a long chat to was Emily. And so here we are. And Emily's got a really interesting story, lots of things that she's done in her life. But I guess one of the big factors is that you were a nurse, or you are a nurse. You were a nurse over in London during the COVID-19 pandemic.
Yeah.
So
What took you from Australia over to London initially?
I went over travelling, I think when I was about 2021. I did the classic top deck Kentucky kind of trip and just arrived in London and just loved it. Just fell in love as soon as I landed, and I was like, I'm going to live here. I'm going to work here. I'm doing... I was already studying nursing at the time, and I was like, I'm going to come over here. I'll finish my degree. I'll, do my grad year, and then I'll come over and I'll live here. I love travelling and seeing different things. And yeah, like my parents were born in the UK, so I've got a British passport. They came over as kids, so it's really interesting. They don't have much of a connection to the UK because they kind of grew up all in Australia. And, yeah, my grandparents, all came over as 10-pound poms and very much left it behind them. My grandma misses it every day still, but my pop's like, nope, like I'm Australian. I'd never go back. You know, they've gone back for holidays, but they'd never live back there. So, yeah, I just fell in love and we've still got some relatives there and stuff. And so I was like, I'll just go over and, you know, see how it is. And, yeah, arrived and, just loved it.
So you like me, did you have a grandparent entry visa where you could stay for 4 years?
No, I've got a passport.
Oh, you had a passport
Yeah,
right
I've got
from
a
the
passport.
start.
Yeah. So, yeah, it was so funny when I was over there, you know, I'd have other, like, Australians back here or, you know, other people, and they'd be like, how'd you go getting a visa? How'd you do this? How did you get a bank account? How'd you do this? And I was like, I've got a passport, so it was really easy. And I was like, sorry, guys, I'm no help. I was like, and, like, how I got, like, a national insurance number, which is, like, kind of equivalent to, like, a tax number. My auntie just wrote on a gas bill, Emily Regan lives at this address. And I, like, walked into a government office and I was like, can I have a national insurance number? And they were like, yeah, cool, yeah, here you go. Whereas everyone else is like, I've been fighting for weeks to get one. And I was like, they just wrote my name on a bill. And I was like, it was so easy for me. It was so easy.
You really strike me as someone who's just like, let's just get things done. And that sort of comes across with your nursing as well and just everything that you do.
Yeah, probably. I think sometimes people are like, maybe just don't be like that. But I don't know, I guess that's just how I am. It helps a lot in ED, I have to say. Like, you know, we're fast and loose in there. We don't have time to mess about. So it's helpful. Yeah, it's helpful at work. Sometimes in life I think people are like, just calm down. And I'm like, no, I'm okay.
But you have to make decisions really quickly, right?
Yeah,
you
absolutely.
Have to, otherwise, you know, people die on your watch.
Well, yeah, I mean, yeah, exactly. And it's very much like a team effort and all that kind of stuff. And, it is kind of, you know, sometimes there will be clinicians that are umming and ahhing and you're like, no, like we need a plan. We need this sorted. We need, you know, this person can't just sit around here or, no, they can't just go to a ward and be dumped there. Like we need a plan. We need stuff sorted. So, yeah, it does come in handy, I think. I use it to my advantage anyway.
So you came back, finished your studies, you'd done your quick trip to like travelling Kentucky, loved it, came back and finished your studies? And
so I think I was like first or second year.
Okay.
When I went over, I was pretty early on into my degree actually. And then, finished, did my grad year and then kind of went over straight away. And then, stayed for 7 years.
Mm. Mm. And how was your work when you first went over to the UK?
Yeah, it took me a while to get my nursing registration initially. The way that they were doing it at the time was a bit of a shambles. And so it took me about a year to get it recognised, which was like frustrating, but I also kind of knew I went over and I'd worked in pubs and stuff before as a student. So I was like, I'll just work in a pub and do this and do that. So I did that for a little while. I did healthcare work, like healthcare assistant work. I did living care work for a guy for a little while, a guy who's quadriplegic, lovely man, like we're still friends now and stuff. I just rolled with it, I guess. And then, waited for my registration to come through. I had to do tests and exams and an English test and all sorts of stuff. But, it was taxing, but I finally got it. And then, I just agency nursed initially. So I worked in hospitals. I worked at a school for a little while as a school nurse. I was did community nursing, like district nursing stuff. And then, started at St George's Hospital and then moved from there to St Thomas's and then was at St Thomas's, Guy's and St Thomas's for all of COVID.
Gosh, St Thomas's is quite a famous hospital.
Yeah,
Tell us a bit for our listeners who don't know St Thomas's.
Yeah, so Guy's and St Thomas's there's kind of two buildings of it, I guess, like two campuses. Guy's is in right near the Shard and, you know, in that area of London, so also a really prominent, lovely area. And then St Thomas's, where I was, is like their main centre, and that's opposite Westminster and Big Ben. So it's right on the river. So it's a lovely view when you walk out. You know, it's just iconic, like a view right near like London Eye and all of that. And it's like the kind of like premier choice for all of the politicians there. And it is very well funded. It's a very good hospital. It has a very good reputation. It's got a very, very wealthy charity. Yeah, quite a reputable hospital. We would have people coming from kind of out of the area to be seen, and you'd be like, and they're like, but you're one of the best. And you'd be like, yeah, I mean, you probably should be seen in your area first, guys. But yeah, it was a wonderful hospital to work at. It was where Boris was treated for COVID.
That's what I thought.
Yeah.
Rang a bell.
Yeah.
I was in the UK at the time.
Yeah. So, I mean, he didn't come through ED. That, he was ferried in through the back, which is fair enough. But, yeah, that was funny. I remember taking a patient up to a random ward one time. They were being admitted for COVID. And Boris had been moved and, it's all on the down low and it's like, where is he now? And we pulled out just like the middle of the night, rocked out of the elevator on this random floor and like turned to the side. There's just all these armoured guards. And she was like, well, I think we know where Boris is. And I was like, yeah, I think so too. We're just the other side. So it was like all down low, but it's like, oh, there's armed guards everywhere.
Wow.
So, yeah, it was an interesting time.
It was quite different in Western Australia. We didn't really have a lot of cases and I guess we were able to see what was happening in the rest of the world. But London was a real sort of hotspot epicentre for COVID. So it'd be really interesting, I think, for our listeners to sort of hear from you a bit more about what was it actually like. And I think it must have been really quite terrifying at the beginning, was it?
Yeah, so I remember when, I think everyone did, when kind of cases started popping up, out of Wuhan and China, and it's all like, oh, no, it's just like a flu, and it's fine and it's normal and stuff. And then everyone, because London is so, like such a travel hub and, anyone that was coming in from China that had any symptom, we were like, oh, isolate. We've got to isolate, we've got to swab them and do all this. And at the time, I was pretty new to ED. I'd only been there, like emergency, probably like 4 or 5 months. So I was like, I was pretty fresh into working into ED and in the department. And I'd actually been fit tested for the mask, which was, they were like, oh, this never gets done. You guys are new. We'll do it all for you. It needs to be done, but it's one of those checks that just gets kind of forgotten about. And so I was fit tested. So it was like, oh, everyone, you got to swab them, you got to swab them, you got to swab them. So like for some days it was like, oh, I'm a swab nurse. And I remember first, one of the first times, me and a doctor went in and they were in, like a negative pressure room, and it was a lady, I think, and her husband and her child, and we had to get dressed in scrubs, then go into the negative pressure room and then get out and in the other in the little change area, strip off, get re-changed again, and it was just. You're there being like, this is next level, guys. This is extreme. And these weren't even, they didn't even turn out to be COVID, but it was like, oh, they're from China. And, originally it was very much like, oh, anyone from China, we're treating them as COVID. And, and you're like, I mean, okay.
Out of the million tourists that arrive in London every year, let's check them all.
Yeah, but no, these ones specifically originally. So, it was, and that was, it was originally kind of, I don't know if everyone is feeling it or what, but it was all a bit like, oh, this is just a bit like, I didn't think we realised what it was going to morph into. And then I remember the day when all of our training got cancelled, and it was like, oh, this is serious. They've just cancelled everyone's upcoming, any courses that people had booked, any, revalidation stuff, any of that kind of stuff. It was like, nah, it's cancelled. And it was like, oh, wow, this is serious. And then I think we went into lockdown. It was like lockdown was announced really soon after that. And, it kind of, for me, it felt like it was like, oh, it's just a bit of a flu, to, oh, my God, no, this is really serious. We need to conserve resources. We need to pull everyone. We need to close down, all of these, outpatient clinics and, redivert everyone into critical care areas and stuff. And, it kind of felt like the world changed overnight. I remember I was sending my mum a voice message and I was like, oh, so, and sounding a little bit anxious about what was going on. And by the time, it was a 10-minute classic, 10-minute podcast voice message. And by the time the end of the message, I'd calm myself down and be like, no, it's okay. It's going to be fine, this or that. And she called me and she was like, are you okay? And I was like, if you listen to all of the message, I've calmed myself down. I'm okay. But originally I was just worried about, I was worried about family. I kind of wasn't worried about myself getting sick or anything like that. I don't have a respiratory history. I'm relatively healthy. I'm young, active, all of that kind of stuff. But I was like, oh, if my grandparents get this, and like my granddad in particular, I was like, this is going to be serious. And what happens? Like, what happens if I'm over here and he's really, really sick, and all that kind of stuff. So when it came out that WA, had fully locked down, and they were, originally pretty low cases, and it all got contained pretty well, I was like, oh, it's fine now, like it's fine. And then you just kind of crack on and deal with work every day. So I don't know, I didn't really worry for myself too much. And there was people in the department getting sick, and thankfully I didn't work with anyone that, got, that passed away or anything like that. There was people in our hospital and like external and stuff, but no one that was directly like connected to me. So I was pretty lucky throughout all of it.
Today's episode is brought to you by my online course, Emerge from the Pit. This course I developed for anyone who is going through a sudden and unexpected life event when they were least expecting it and is struggling to cope. This happened to me in late 2021, where my life was going extremely well, and then in an instant everything was turned upside down and I struggled to cope. Over the next weeks and months, I documented my recovery and the tools and strategies I used to get through this extremely difficult period of my life. So if you can relate to this and you're struggling to cope with something that's unexpected and life-changing that has happened to you, then check out my online course, Emerge from the Pit. And for our listeners on Double D's podcast, there's a 20% discount. If you go to my website, www.donnasbalconyviews.com.au, you can click on the online course and check it out. And if you think it's something you can relate to and something that can help you based on the tools that help me, then put in the coupon code Double Ds, so one word, Double DS, and check it out. And these are things that I developed over time and that really, really helped me a lot. And I know that if you're in a similar situation, they can help you too.
So what was it like in the hospital when patients started coming in and they were quite serious and things like that?
Yeah, originally it, because I mean, like London locked down, well, the UK locked down a lot later than other places. And before we locked down, it was intense. It was really, really busy because we were having about 700 presentations a day to ED, so 700 patients through the door. And then with that, just a really big change in acuity. So, resus would be full all day with intubating people and just back to back, all of this stuff. It was like, oh my God, we are drowning. We are drowning. And then lockdown got called and people were afraid to come to the hospital for other stuff. Yeah, so we were only just seeing COVID. And, we went from 700 presentations to like 40 or 50, kind of in like a week. And you're like, oh, and part of it was like, oh, this shows how abused the system is. But also the ambulance had different criteria for what they need, what they were authorised to bring in and what they weren't. So that changed. So, it was, people were being left at home when before they wouldn't have been. They would have been brought in and, that kind of stuff. And that's like, it was really sad. Like on reflection, you're like, this is so sad. But it was like nobody knew what was going on. Nobody knew what was to come. And it was this worry of like, we're going to run out of resources. Like we need to conserve our resources. And they pulled a lot of staff to ED. So intensive care and ED became like protected work areas. So they pulled a lot of resources to us. And so we had lots of extra staff. They had amazing, the hospital that I was at, we would have special teams that would come down to help intubate patients. So you'd get them in and they would have, pretty much all the equipment that they would need. They would just need some medications from us from the cupboard. And it would be like one or two nurses from ED that would help. And, you'd have people walk in intubated 20 minutes later up on ICU. And that's like unheard of in healthcare. Like the thing that we're waiting around for was because intubation is what they call an aerosol generating procedure. So you're in all that big kit and in all that PPE and, all that kind of stuff. And you need to wait 20 minutes for the aerosols to kind of settle before you leave the room. So everyone would just be standing there for 20 minutes and that would be what would be taking up the time, not actually doing the procedures, not actually doing all the stuff. It was just so streamlined and like for the first wave. And then like we started to get, then more people started coming back in because, they were getting sick with other stuff. And, lockdowns kind of like a bit of the world like reopened again and stuff. And so then we got like massively busy again. And then second wave happened and we didn't get any extra resources and we didn't get, those teams and we didn't get staff pulled to us. And so we were drowning again. And that was kind of like Christmas 2020. And that's when I kind of like spoke out and spoke to the media in Australia and stuff.
So tell us, like, how did you start to speak to the media? Like, what catalysed that?
It was a bit random. There was a girl, like a freelance journalist that just posted on the Aussies in London page and she was like, I'm writing an article about why people have decided to stay in, why Aussies have stayed in London rather than move home. She was like, send me a DM if you're...
Because we can't get into Western Australia because it's locked down, maybe?
Yeah. She was like, just send me a message if you, want to be included or have anything to say. And I just sent her a message and I was like, hey, like I'm a nurse. I, had a job here. I have a life here. I knew if I went back, I'd be, back living with my parents and, be looking for a job and, this, that and the other. And I was like, I also knew I was more needed here than in Australia. I was like, because it kind of got to a point where it was like, if you don't come back now, you're not coming back. And you're locked out. And it was a point where things were really ramping up in the UK and things were showing that they weren't ramping up in WA. And I was like, well, I'm going to go back. I'm going to be searching for a job. I'm going to be searching for a house, like all while kind of this, like, I want to say mini lockdown for you guys because it was still a lockdown, but all while life is still not 100% normal for everyone. I was like, whereas I've got a life here, I've got a job that I love, I've got, a support system. As much as I was away from family and stuff, I still had a support system. And I was like, if I leave now, I'm not coming back and I'm not ready to leave. So I stayed and I just kind of, shared that.
And also it sounds like you had quite a lot of fulfillment from actually really contributing in the way that you were. You're quite a high-energy person. Sounds like you want to be really, busy and contributing in your work.
Yeah, absolutely, yeah. And I love what I do. And I'd kind of, when I was at uni, I was like, I want to be an emergency nurse. Like I want to eventually get into emergency. And I'd done a lot of different things because I like to learn different things and experience different things. And I was like, I know when I get to ED, I'm going to love it. So let me not pigeonhole myself straight away. Let me try a few different things. And I was finally there. And it was like, I'm, living this dream that I thought up like 5 years ago and I'm finally achieving it. I was like, am I going to let this, bring it to an end? And I was like, no, I'm going to stay and I'm going to be here and I'm going to, deal with the consequences of that. And okay, if I'm locked out of Australia, I'm locked out of Australia and, I'll deal with that. So, I kind of shared that with this girl and she was like, oh, thanks so much. She was like, lots of people have kind of said the same thing. She's like, I'll let you know if I use anything. And I was like, yeah, no worries. Didn't think anything of it. And then I think it was about a few weeks later and she reached out and she was like, oh, hey, I want to write an article about what it's been like nursing here. She was like, she was like, I feel like you guys are doing it really tough and it's really hard and I want to share that. She was like, because I don't necessarily think that Australia is understanding that. And I was like, yeah, I absolutely agree. And particularly and it's really hard to know what people's experiences are when you weren't living them. But I'm like, I had, friends being like, oh, I can't go to Melbourne. And I'm like, I can't go to the grocery store.
Yeah.
And it was like, yeah, people, and you get it. It's already the world's kind of imploding. You're not looking for bad news. You're not going out there being like, oh, I'm having a bit of a rough time because my life's a bit different now. Let me go and search for people that are having a worse time. That people don't do that. We know that, we know that. So everyone was, it was like, guys, I'm probably a little bit more of a stressful situation than you, and I don't really know that, Australia kind of in general.
I can really relate to that because I was in the UK and Scotland when it all hit, and then
and Scotland was bad too.
Scotland was really bad, and I was coaching like doctors who were trying to survive in the midst of all of that and care for their staff and keep the services going, manage their own burnout, all of that sort of thing. But then also my kids were going to uni, one of them had just gone to uni and was in total lockdown. And people when I moved back here, it was about August, I think I came out of quarantine in 2020, and people were saying, oh, yeah, it's been really hard, hasn't it? And I'm like, yeah, how hard has it been for you? And they're like, yeah, we, like you say, couldn't go to the shops, or we couldn't, meet somebody or go travelling across the state. And I was like, right, okay. And I just never felt that they really actually understood what lockdown really meant for people in the UK, and also how long it went on for, like these waves and waves and waves. And we're nowhere near recovered over there from those effects, right?
I don't know that it will ever recover. That's the thing. Like, there is the healthcare system kind of shut down for 2 years over there. Outpatient stuff, even in the first wave, it was, say, 3, 4, 5 months of redeploying all of those staff back into, high acuity areas. That's 4 months that you push back all of those patients. Like, the patients didn't go away. The stuff didn't go away. It's just been delayed, and then it's delayed and delayed and delayed. And, I'm not sure that it will ever recover from that. And I think, it was
real for you.
Yeah, it was real. And it was, nobody at home got it. Like, as much as, it was like, oh, that's, I can understand it's really challenging for you and that's it. But I had no one in Australia that actually understood what it was like, because firstly, nobody, like, I didn't know any nurses in Melbourne, and that would have been the closest that it came to kind of like similarities of stuff. And WA, like, I mean this nicely, they got off pretty scot-free. Like, yes, like, like the borders being closed was really challenging for people, and I know of people that couldn't get back for funerals and events, and, I couldn't come back for my own sister's wedding and all of that kind of stuff. And, that was really horrible, but the reality is life continued inside the state. Yes, there was a little bit of lockdown, but life did continue. And yes, policies had to change and things had to change, and, oh, yes, social distancing and all of this. And when you're not having like in the UK, we understood why we needed to social distance, because you were seeing it every day. You were seeing the numbers grow. You were hearing about all the people, passing away, and the death rate, and all of the hospitals that were, running out of resources, and we've, had to open up a whole new hospital because we don't have enough beds, and this, that and the other. So you adhere to the rules and you understand it because it's being, you're seeing it every day. Whereas I understand here, it was kind of like a distant issue. It wasn't an in-your-face issue. So it's like, it's more of an inconvenience. Following the rules is an inconvenience because it's a distant issue.
So what was what happened with that interview that you did with the journalist? Yeah,
so she kind of just sent off some questions, and she was like, here's some questions. And originally she was like, I can keep you anonymous. I don't have to give your name. I don't have to do this. And I was like, yeah, no worries. Just rolled with it. And, she sent off some questions, and I sent them back, and she was like, thanks, great. I'll let you know, what the next steps are, kind of thing. And it was like I think it came out early January or something like that. But it was she was like, oh, there's some media companies interested. She was like, but they want names and they want faces. She was like, are you happy to put, are you happy to put your name in, to put your face? And I was like, yeah. I was like, but I'm not listing where I work, because at the time, because Guy's and St Thomas's doesn't really engage with media stuff.
No.
A lot of the other hospitals were, but they weren't. And so it was like, any media stuff, you need approval. And I was like, well, they're not going to approve this. So if I don't mention where I work, it doesn't matter. Because it also wasn't about where I was working.
No, it was about the context.
It was just about everything that was happening and how life was there and what was happening. And I was also at a very, very wealthy hospital, a well-resourced hospital. In the scheme of things, I was fine. I was absolutely fine. There was a lot of hospitals that were doing a lot worse, a lot of nurses that were doing a lot worse. So I was like, it wasn't about where I was working. It was just about what was going on in general. And so I was like, yeah, no worries. I'll put my face to it. I'll put my name to it. And then I think it was about 24 hours before they were going to print, and there'd been a big riot outside, like protest outside the hospital, because it's near Westminster Bridge, which is usually where the New Year's Eve fireworks and stuff are, and that event had been cancelled. And so there was COVID deniers and like stuff protesting against it, and also because opposite Westminster and Parliament and all that kind of stuff, it was a bit of a hotbed for things going on there.
Seat of free speech and all of that.
Yes.
Debating.
Yeah. And And the journalist contacted me and she was like, did you see this? She was like, I know this, because she was like, media people have reached out and said, do you know any nurses? Yeah, and any of the nurses working near here, did any of them see this? Is there a comment? And one of the doctors that I'd worked with had tweeted about it, and that tweet had kind of gone viral, and he got in a bit of trouble about it from the hospital, being like, we don't comment, we don't do this. And he'd been asked to go on a lot of media stuff and all of that, and he was like, oh, no, I can't. The hospital said no. And I'd spoken to him about it because I was like, I saw your tweet, yeah, good on you kind of thing. And because he just said, I've spent 12 hours, kind of saving people's lives in here, dying of this disease. I come out here and there's people pissed off, sorry, language warning, annoyed that they can't, there's not fireworks going on, have some perspective kind of thing. And I said to her, I was like, I didn't see it, but I was like, I've seen other protests and experienced other stuff. And she was like, do you have a comment? And I was working in the the resuscitation department at the time, and we just intubated someone with COVID. There was more people flying through the door. And so I just flicked off, being like, blah, 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 whatever kind of thing, not really thinking about it. Sent the email off and then just cracked on, got back to work. And then I was on night shift, went to bed, woke up the next day for shift, and my phone's blown up. I've had all these missed calls. I've got all these messages. My social media is going wild. And I was like, oh, my God, what's happened? And it had gone to print and it was my face. Oh. That was the headline photo with Australian nurse in London says, stay in your lane, COVID denied, you don't know what you're talking about or whatever. And I was like, whoops. So I was like, oh.
Was that your actual line though, stay in your lane?
Yeah,
was it?
I'd said, which it was so many years ago now, but I'd said something along the lines of until you've seen someone dying of this disease, until you've seen this, you don't know what resources are used. You don't know the time and energy that it takes into saving someone's life. So stay in your lane. You don't know what you're talking about. And the journalist, she was like, honestly, as soon as you sent that back, I thought, wow, there's the headline. And I was like, I just didn't think about it. I was just busy at work, send, off I go. So
what happened next?
I walked into work and everyone was like, oh my God, I've seen your stuff. And it was really it was lovely. But it also, I had a lot of, nurse friends that were like, I've sent it to my family. They were like, who are living here, because they don't get it. They're like, even though they're living here and, they're going through it as well, they're not working in it. They don't get what it's like. They don't understand actually what it's like. So, yeah, it felt like I was quite, proud, I guess, that it had resonated not just with, people in Australia, but people locally that could be like, yeah, this is – you've spoken out and you've said exactly what all of us are feeling and, what we're all thinking, and thanks so much because, I've sent it to my family so that they can get a better understanding of what actually it's like and what's going on and all of that. So, it was good. And then, I had lots of people contacting me, finding me on social media being like, you're a liar and how much did they pay you and you're like, yeah, whatever. I'm a bit like, if you have enough time in your day to troll social media, to find a person whose profile is completely random with a very, very common name, probably not really adding much to society in the first place. So I'm just going to let that pass by. I'm like, if you've got all that free time on your hand, maybe channel it in a better way next time. But, it was fine. And then I had, some other media people being like, I think I went on Sunrise, breakfast or whatever, and did an interview there and stuff. And so it was a bit,
minor media celebrity
minor,
by this stage.
Minor.
Wearing black as well?
Or? I think I actually wore green.
Oh, green.
Did you? In the TV. Oh. Yeah. I think I spiced it up a bit because it was also winter, so I was so pale. And I was like, I'm going to look washed out, better wear some colour. But, and then I just kind of got on with life, didn't really think about it ever again. And then, the High Commission called one day.
This podcast is brought to you by my business, Coming Up for Air. That's coming up number 4, Air. This is a business which cultivates curiosity, compassion and courage through executive coaching, workshops and leaders' retreats. Donna, you've been to one of my retreats.
Yes, and as a senior leader, I decided to invest in myself and go for a day. It was on the weekend, a full day retreat. I'm so glad I did go. It was just what I needed in my life at that time. We spent time on our own, reflecting on questions that you gave us, Di. We spent time with others there, being creative, which I don't often get the chance to do in everyday life. And my absolute favourite part was spending some time with the horses that were on the property. The horses have such a calming effect, and I just left the retreat feeling completely rejuvenated and had time to think about some important life questions that you don't usually take the time out to think about.
Thanks, Donna, and I didn't pay her to say that. I do run retreats at various times through the year, which are open retreats, ideal for leaders, just as you said, Donna, to get away from the busyness of work and life, and often we don't take this time to invest in ourselves. You can find me on Instagram or at comingup4air.com.
So tell us the story about when the High Commissioner rang and what happened then.
After all the kind of COVID stuff, I made a LinkedIn. I'd never had one before. And I made a LinkedIn because I was like, I should probably, do some, focus on some professional stuff, get a LinkedIn. And so I'd listed where I'd worked on my LinkedIn, but nowhere else, during COVID or whatever, I never ever had it listed because I didn't. Also, it's my personal Instagram and I don't want to be associated with work and all that. I don't really have on social media listed that I'm a nurse. But on my LinkedIn, I was like, I'll make that professional one. So I had where I worked listed, but I never went back on it. And then, I was in, again, resus one day with a really, really poorly patient. He was,
Poorly, for those listeners. I understand it. Poorly means very ill.
Yeah, very ill, very unwell.
Poorly is a very sort of English-Scottish term, isn't it?
I know, and it's so funny. It's the same, when I first moved over, I was like, poorly. I don't understand what this means. What does this mean? And now I use it all the time. Yeah. And I'm like,
it's all right, I'll be your interpreter.
I know, I need to get out of the habit of saying this, but I'm like, poorly. And same Marty and all this stuff. And people are like, what? I'm like, let me translate.
So sorry, I interrupted you.
No, please.
Very unwell patient.
Yeah, really, really unwell patient. And I was in CT with them and my friend came through and she was like, the Australian High Commission's on the phone for you? And I was like, what? She was like, I've asked them 5 times, mate. I don't, just take the phone. There's someone, they're on the phone for you. And I was like, oh my God. And the first thing I thought was, oh my God, is this about my unpaid HECS? I was like, I haven't done a tax return in 2 years. I was like, I haven't paid my HECS back for the last 2 years.
Australian High Commission.
I know. I was like, oh my gosh, is this? And then I was like, no. I was like, it's only a few $1,000s. They're not going to be chasing me up for that. And then I was like, oh God, have I come in on the wrong passport? And I was like, no. And I was like, because while I'd come home a few months before for my other sister's wedding and had to renew my Australian passport when I was there, and I probably shouldn't admit this out loud, but I left Australia without my new passport and then someone brought it over for me, thankfully. But I was like, no, I didn't even have my Australian passport on me. I've come in on my British one. And I was like, it's a joke. This must be a joke. So I was like, hi. And they're like, is this Emily? I was like, yeah, who's this? And they're like, this is Hannah from the Australian High Commission. And I was like, oh, yeah, is it now? Because it sounded like one of the girls I worked with. And I was like, they're just having a laugh. They know I'm really busy with this patient and they're just having a laugh.
Michael McIntyre's about to walk out or something and open the curtains.
Yeah, I'm like, this is an absolute joke. And so she's like, oh, no, this is what, and she was like, we want to invite you to the, King Charles's coronation. And I was like, yeah, what? I was like, and this girl who I thought it was this girl, Regan. And I was like, Regan, stop having a laugh, mate. I'm busy. What? This person's like, oh, no, and they were like, no, this is this person and this is what we want. And I was like, look, I'm in resus right now. I am very busy. I'm at work. You give me your name and number and I'll call you back. And there was 5, 6 people in the, in CT as well looking, and I was hung up and written this name down being like, oh yeah, whatever. And they were like, what was, and I was like, someone from the High Commission invited me to the coronation. Yeah, good joke. And they were like, it's a weird thing to joke about. What? And I was like, nah, it's absolutely a joke. That's so a joke. And they're like, that's a really weird thing to joke about though. And I was like, no. And I was like, it'll be Regan. It'll just be Regan. And so, yeah, my mate went out and went and found her and they were like, it wasn't her. Like, she hasn't been on the phone. She hasn't left. She hasn't done anything. And she came back and she was like, it's not her. Like, it's not, like, this might be real. And I was like, this isn't real. And they're like, Google this person, Google them. Pops up with their name, their LinkedIn, High Commission, all this. I was like, oh my God.
So how much time had passed from when you hung up the phone to
being like, oh, this is
being
real?
aware that this possibly could be?
Probably like 5 minutes. Okay. I kind of forgot about it because I've also got this really unstable patient and I'm like, I don't care. I've got to, let me get them back. Let me get, and because CT out of the department. So it's all a bit like, oh, it's a bit dicey. So got him back, got him sorted. And people have been Googling, being like, no, I think this is real. I think this is real. Like, you need to call her. You need to call her back. And I was like, I'll call her when I'm not so busy. No. And it was like, that person's looking after that patient now. You go and call them. So I called them. I was like, oh, hi, just like to apologise for and they were like, no, we're so sorry for bothering you at work. And I was like, no, I thought it was a joke. I'm so sorry. Put on my most professional. They're like, oh, so would you be interested? And I'm like, yeah, I'd be interested. And they're like, oh, and for the concert as well. I was like, yeah, I can make myself available for that. Yeah, no worries. So, and then they were like, this is obviously highly confidential. And I was like, oh, yeah, thinking, mate, half my department knows about this because you've called me at work. And then I came back in and they're like, what? And I was like, oh, nah, and they're like, is it? And I was like, no, it's just about something else. Like, it's just something else that they want to talk to me about. And everyone's like, this is, and I was like, just ignore it, guys. And they're like, this is real. And I was like, no. And then they were like, oh, we'll send you an email with all like confirmation stuff and this and that. And I was like on my way commuting home, sending my sisters a voice message about it. And I started the story being like, oh, had this really interesting patient today. And like talking about that, I was like, and then the High Commission called. And both of them were like, mate, we don't care about the patient. We care about the fact that the High Commission's called you and invited you to this cool thing. And I was like, oh, yeah. I was like, but the patient was really interesting, guys. Like, I was like, we did not think that what was wrong with it was what was going on. Yeah,
first
I know.
And foremost.
I was like, guys, this is really cool. So, so then it was kind of like a few weeks. But when I met the lady, like Hannah, lovely lady from the High Commission, and I was like in person, I was like, just again, I'd like to apologise. And they're like, no, it's fine. Like, it's fine. And they're like, they had been trying for weeks apparently to get hold of me. They were like, you're really hard to find, which kind of made me feel really good. And I was like, oh, I like that. I like that you can't find me easy.
So did they give you a reason, like, why the invitation?
Yeah, kind of, because I said that, like, I was like, why me? Like, why me, guys? And it was so, like, Prime Minister Anthony Albanese had obviously been given a certain, like, allocation of, like, people that they could invite because we're in the Commonwealth. And he'd picked a few people. He was like, oh, I want this person, and then find me people that fit, this brief. So find me people that, like, obviously have a connection to the United Kingdom, and it was like, they want like a kind of mix of genders, mix of ages, mix of places from Australia that people are from, and like mix of like industries that are, kind of like, help promote Australia overseas and all of that kind of stuff, I guess. And they were like, oh, well, you're young, like you're female, you're in health, you're from Western Australia, like you're living here. And that's what they said as well. They were like, you're still here. They're like, a lot of people left. Like when COVID started, they were like, or just after COVID, they were like, and you're still here. So kind of was a bit of a luck of the draw. And they were like, and we could find you. They're like, you had some form of an online presence because of the little bit of media that I had done in COVID. So, yeah, it was one of these, and so many people were like, oh, did you apply? Like, why? Like, and I was like, no, man, they just found me. And they're like, why? I'm like, I don't know.
So you were only one of only 14 Australians that went to the coronation. So how was it? Was it
it was good. Yeah, it was, I mean, the whole, like, ceremony and service and stuff was so long. Like, I mean that respectfully, but so long. But it was like, I mean, also I'd really never been in Westminster Abbey, and you got to pay like 25 quid to go inside, like $50. And I got in for free. So I was there being like marveling at because the building and stuff, and being like, I'm going to take this opportunity to be inside here. Like, yes, this is for an amazing event as well, but I was like, I got in here for free. But yeah, it was amazing to meet everyone and like, to kind of see it unfold and stuff. And like, I'm not religious. I'm not a royalist at all or any of that kind of stuff. But It was actually Adam Hill's, not to name drop, but
Why would you not name drop?
I know,
Come
he's
on.
such a lovely man. He's honestly so nice. And he was like, we're watching history unfold. And I was like, oh my God, yeah. Like, and it kind of was one of those things where it was like 2,000 people were in that room and I was one of those 2,000. And you're like, that's pretty cool. Like, that's a pretty cool thing, to be a part of and experience and stuff. So, yeah, and just more like kind of, like the people that I met and, like just the experiences that came from it and stuff was so amazing as well. And, yeah, I mean, I've never had to wear a fascinator in my life. I got to wear a fascinator. That was cool, and all that kind of stuff. So, yeah, it was
It's a very small hat for
very,
anyone who doesn't
fancy.
know.
Yeah, and they're so overpriced for what they are, may I just say. May I add that comment? But yeah, it was kind of, so we did like an afternoon tea before as well at Stoke Lodge, which is like the High Commissioner's residence in London. Very lovely area, very lovely house. If anyone's looking for a future career plan, great location, great house. And like Stephen Smith, High Commissioner, also lovely guy. He was so welcoming and so nice. And when he found out from Western Australia, he was like, me too. And so we're having a chat about WA and all of that kind of stuff. And yeah, everyone was lovely. I met Anthony Albanese at the afternoon tea, also was lovely. Like his partner, his fiancée now, she's amazing. Really rate her. I feel like I have such a higher opinion of him because of her. And she was lovely. She kind of made a beeline for me. So yeah, there's like everyone there. There's like Adam Hills and Nick Cave and
we don't
Sam,
really.
I know. Well,
we don't,
Sam Kerr, all of these really important people, and then this Dr. Daniel Nord, who's was like Australian of the Year not that long ago, who set up this amazing kind of charity, Streetside Medics in Sydney and now moving to Melbourne as well. And it's like helping homeless people, get better access to healthcare and stuff. And then, people that were working on like the COVID vaccine and, amazing singers and Victoria Cross recipients and all of like artists and, all of these people. And then I'm like, me. And I'm like, oh, and they're like, oh, so what did you do? And I'm like, oh, I just nursed in COVID. Like, I haven't
nursed in COVID.
Well, no,
the most important job.
Yeah, but, I didn't do anything more remarkable in that than anyone else that I was working alongside. That's the thing. Like I didn't, everyone that I went to work with every day was working just as hard as me, doing exactly the same job. And it was just, I got picked. I was the lucky one that got picked. So, yeah, it was interesting to be in that room. But it was amazing. It was lovely to meet everyone and, all of that. And then, we all got dressed up and, went to the coronation. I sat with Adam for it and this lady, Claire Spencer, who's the CEO of Barbican in London, which is like a huge arts centre. She's really she's done a lot. She's got an Order of Australia actually for her contribution to the arts in Australia and all that kind of stuff. She was amazing. I feel like I won the lottery with who I was sitting with. Because they were such good fun.
But you strike me as someone who you would make it fun because of who you are.
Oh, well, thanks.
We're having a lot of fun here just listening to you. So I kind of get that, you probably attract it as well because of who you are.
Well, I think it was funny. We were at, when we were at the afternoon tea, like a few days before, I was there being like, oh, my God, I don't know anyone. And I was going to work. Like I was in between night shifts as well. So, everyone's there was like champagne and this. And I was like, oh, I'll just have a water, thanks. Like I've got to go to work in 2 hours' time. But they, it was like Prime Minister Anthony Albanese got up and, welcomed us all and said a speech. And then Stephen Smith, got up and, welcomed us to his home and said something. And then it's so bad who I've forgotten what their title is. Oh, the Governor General. Bit of an important person. He got up and spoke and he was, because the other two were very much more like, thanks so much for, coming along and, congratulations and everything that you've done. And, this is, a lovely experience for you and, lovely to have you along. And he was there and he was like, you are representing Australia. You are the eyes of Australia and you are, he was really serious and really like, you're there for them. And so you, put on a good face and you do that. And I was there like, oh, this guy's intense. I was like, this is an intense chat. And Claire was next to me and she like leaned out and like we kind of side each other being like, and she was like, I'm just coming along for the fun day out. And I was like, me too. And so after that, I was like, oh, like you. It was like you and I was like, that's good. You're a laugh. And then, both of us were fangirling Sam Kerr, and she's like, I need to go and say hello. And I was like, I'll come with you. And we're like, hi, Sam Kerr. Like, we love you.
We've got to call you by your first name and your surname.
And it's the same. Like, it's the same with, like Adam Hills. Like, so he, lovely guy. He took us to his restaurant afterwards as well, which was some of the best food I've ever eaten. Anyone who's in London, in the UK.
Okay, what's the name of it?
It's called Freak Scene. Okay. So the chef is a guy, Scott I'm going to get his last name right. I think it's Holsworth. He's a West Australian as well. Shout out to the WA kids. He trained under Nobu and stuff, but it's such good food. There's 2 now in London, which is a good sign in London.
Okay, we have got some London listeners. Well, even if only one of them is my son.
Well, go honestly, it's so good. They do Tight Ass Tuesday as well. So I mean, he's bringing the Australian over there, Australian theme over there. But it was so good. So we went to that. A handful of us went after that, which was lovely. And you kind of got to know everyone a bit better. It was a much more relaxed environment there because there's no Prime Minister in the corner or no High Commission staff and that kind of stuff. So that was really lovely as well.
It's incredible though how an event like that can just bring such diverse audience together who would never naturally be together. Yeah. And yet you can find that connection, right, over all sorts of things that you would never cross their paths.
Oh, yeah. It was, And I mean, I've never in a room like that. I never meet, people the only time I meet people like that is if they're my patient. I'm not in, that scene for events like that or
but
any
even
of that.
It's such a leveler, isn't it?
Yeah.
I would imagine nursing care is just, it just levels the playing field. Your health as a human, such a fundamental.
Yeah, and it was really interesting, because everyone's like, oh, so you're the nurse, and I'm like, yeah, and they're like, oh, how was it in COVID? What was it like nursing in COVID? How's and it was everyone. I was, everyone's like, oh, and I made a comment to Adam, being about the importance of the arts and stuff, and he was like, I feel a bit patronising coming from a nurse who nursed, who worked throughout COVID. I don't think I'm as important. And I'm like, no. I get through work by all of this entertainment and all of this art stuff. It's equally as needed and important because I got to wind down.
I so love that you've said that because the arts is one of those really underfunded
absolutely
things often.
Yeah.
And I was actually connected with a guy, a philanthropist in Scotland who really just poured all of his money into valuing the arts as much as any other profession.
Yeah.
And there's not many people who do.
This episode is brought to you by Impact Society. Impact Society is a company focused on helping everyday managers become world-changing leaders. They provide straightforward and stylish tools, training and content to elevate leadership skills and mindsets and help leaders thrive both at work and in life. I personally know the company founders, Sean and Joel, and they have set up Impact Society as they saw a gap in the market for leadership training for technically based staff that wasn't as expensive or as lengthy as a MBA or other leadership courses at university. So essentially they've scratched their own itch. They both come from technical backgrounds, and then Joel set up his own consultancy company, and Sean has been in diverse leadership roles in government and the private sector. We are especially excited about Impact Society bringing you this episode because they have a new product, a strategic planning toolkit, which is designed to help leaders put in place a straightforward strategic plan that any organisation or team can follow. As many of us know, strategic planning is not the easiest or most straightforward thing to do. So this toolkit, I've had a good look at it myself. It's completely clear, easy to follow. There's checklists, there's emails, everything you could need to put in place a strategic plan. And for our listeners of the Double D's podcast, there's a 20% discount on this strategic planning toolkit. You just need to go to impactsociety.co, and in the discount code, when you purchase the strategic planning toolkit, you put in the discount code Double D's, so Double DS at the checkout, and then you'll get your 20% discount. So we would encourage anyone, especially people who are new into leadership roles, to check it out.
Tell us a bit more about what got you through, because you're just starting to touch on like what actually supported you in those really stressful times as well, because I'm sure there's probably been some, but obviously the arts is one of those things.
Yeah, just like being able to kind of disconnect. Like what I really love about nursing is I kind of can't take physical work home with me. You know, I can't take paperwork home. I can't, fire off some emails. One of the hospitals I worked at, I couldn't even access my emails at home, which part of it is good because it's like, you can't do work at home, but also you're like, I want to see if my annual leave's been approved, thanks. Like I'd like some access to my emails. But yeah, I do love, and I do think I'm pretty good at separating work and home. I obviously tell stories and all that kind of stuff, but I do very much like, when I'm in the change room at the end of the day, getting changed out of my uniform into my like civil,
Civvies.
my civvies, my black outfit, and I walk out and I'm done. I'm switched off. Like, and I think that's what I really enjoy about ED as well. Like, I'm not coming back to the same patients the next day. Like, yes, we have our regulars and we have this and we have that, but like I'm with you for the only time that you're in ED. And once I walk out, like I might never see you again, which kind of sounds savage, but it's like it's kind of nice, like at the same time. So I think I'm already like pretty good at, separating work and home. So I just kind of, COVID, it was a little bit harder because you come home and, what I would normally do, like I'd, go to the gym or I'd, socialise with friends or I'd go out or I'd do this and, even just go for a walk. Like at one point we were allowed like to be out for like an hour a day for a walk. Yeah. And you're like, and even like, I remember like you weren't allowed to sit on a park bench. So you could go for a walk, but you're not allowed to sit down. And it's like, you're like, okay, well, I better not pause. Like, better not need to catch my breath. Or you couldn't even like, get,
Lean
take
on a post.
take a sandwich with you from home because everywhere's closed and go for a walk and sit down and eat it. Like you couldn't. So yeah, it was a lot of screen time, I'll admit. I binged Friends a lot. I binged QI a lot. There was a little bit of a cycle there where I kind of couldn't watch anything new. Like it was just stuff that I'd already seen, and it was like, because people were like, oh, there's this new series, and I'd be like, no.
Do you mean almost from a comfort point of view, or do you mean
I think it was like everything was so unknown in the world, like in my life. It was like, we don't know, is tomorrow going to be the day that the apocalypse happens? Like, is it, it was kind of like just, it was so uncertain. And so it was like, I can't watch something that I don't know the ending to. I've already got enough uncertainty in my day. So I think that's kind of how I dealt with it a bit. It was like, no, I need comfort. Like, and I also was like, needed stuff where you didn't have to engage too much into it. Not too stuff where it's like, too absorbing or all of that kind of stuff. It was stuff that you can, just sit there and kind of zone to and not be like, oh, I didn't catch that storyline. What happened there? Like overanalyze the stuff.
Didn't ask too much of you.
Yeah. So that was, for a little bit. And then, absolutely, like Friends, like some of the friends I made in COVID, like that I was working with, the colleagues, like absolutely trauma bonded. Like that is a real thing.
I was actually about to ask that, whether I was listening to a podcast about this a couple of days ago, and they said in like wartime or, very traumatic time, people do actually bond, a lot stronger, and there's potentially less mental health in that crisis as well, less mental health problems because you've got that really close bond. So you did find that with your colleagues?
Yeah, absolutely. And there's people that, and even just people that you weren't necessarily, like even now that I'm like, not like super close with, but it's like you went through it with them. So there is this underlying just like understanding and experience that you've shared that, you're kind of tethered together because of it, because it's like you can say something and they know exactly what you mean because they were there and they went through it and they experienced it as well. And then, like some, good friends, like, we absolutely trauma bonded, like, just all, because you're all so isolated from the rest of the world with it as well. As much as, like a lot of the nurses that I'm friends with are from the UK. like they were born there or like and stuff. But it was also really hard for them because they're used to going home every second weekend or, you know, there was a lot of Spanish nurses in our department. They used to going home, you know, once every few months. And it was really like interesting. I remember them being like, oh, it must be so hard for you being so far away from your family. And I'm like, I've been away from my family for 3 years. Like I'm used to them being on the other side of the world. I'm like, you're used to being able to go down the road and see them and you can't even do that. You know, like I already had those kind of coping mechanisms in place because I was used to being away from family and, you know, like, yeah, okay, I couldn't go home. I didn't have plans to go home in the first year anyway. And then, I was planned to come home for my sister's wedding and then like couldn't afford it with lockdown and stuff. And then thankfully anyway, because when like Perth, like WA went into that little mini lockdown, so they had to reschedule their wedding for later on. So I was like, well, lucky. I was like, lucky I didn't come home because I'd be coming home for nothing.
So you got to go to the wedding?
No. It was scheduled for like 3 months later. It was when, it was so, and like easy rescheduling and stuff for them. And like everyone still made it, you know, minus me and all of that. But I was like, I'm really glad I didn't book and have everything booked in because I would have been there for nothing. But so I kind of was used to being away from I had other like support networks because of that. And then like I really felt for everyone else because they didn't. They were used to, you know, going home or doing this or doing that. And it was like, oh no, you can't leave London. Like, you know, and London was in different levels of lockdown compared to other areas at times and stuff as well. So navigating that for, you know, everyone else there was like really hard and stuff as well. So, but I think, you just form a different kind of friendship, I think, because, you do bond through it.
Yeah, I can certainly relate to that because I'm going through a very full-on stressful work situation in the last couple of years. And I tell you what, the people that have gone through a similar situation, the same work situation as me, we will be bonded for life for the same reasons because you go through so much trauma together. And, only they know what's actually gone on and what you've gone through and all that sort of stuff.
Yeah, and I think even, you know, there's like just, you know, doctors that you worked alongside with and, you know, just people that, you worked alongside with that you will be tethered together like forever because of this because it's like, we all went through that together and we all, you know, experienced that together and stuff. And so, it is I think it's a different kind of friendship that you do form.
And I think that's also why, veterans are so close and, to see each other on annual Anzac Day and things like that.
It was really interesting actually. So one of the Victoria Cross guys, Daniel, his last name evades me right now. But there's like 3 Victoria Cross recipients in Australia, so I can be like Daniel, and people will know who. Like, you know, Google him, he'll come up. But I met him through the Coronation stuff, and it was really interesting because I feel like there was this mutual respect straight away from him because of what I'd worked through. Because it was like, oh, you've been through, like, okay, it's not like not comparing it to the frontline war or anything like that. But it was, this like you've been through a traumatic experience. So you like, it was like this instant respect, like from, you know, him to like, you know, I think it's that military thing as well. Like, you know, it's like that, I don't know, when people put on a uniform and go to work, it's like, you know, there is this different, it was just, and because he's obviously worked with medics and worked with nurses and all that kind of stuff. And it was really interesting, that same thing, because it's like, you know, he obviously has those, you know, relationships with people that he's literally fought in a war with. And then, there was just this instant like, oh, you've been on a different kind of front line. So there's some respect for you for that, like, which, it was really interesting.
Oh, wow. And so now you have come back to WA and you're working in a fly-in, fly-out position in Rio, for Rio Tinto, doing some nursing.
Yeah.
Do you want to tell us a little bit about that? We need to sort of wrap up quite soon. But and what else does the future hold for you?
So came back in October and got a job in FIFO pretty quick, which was good. So I'm working St John on Rio sites. See, it's interesting. It's kind of, I didn't really know. I kind of thought I knew what it would be when I got the job, like when I went into it. And it's like as always is like kind of a bit different. But so it's like with emergency services and health and safety. So you're kind of working a bit like a clinical nurse in the sense that you're working very independently. There's all sorts that comes in. They kind of joke and be like, oh, cough, colds and sore holes. And then there's also like injury. It's very crass, very mining. So there's a bit of that. Because, germs spread like wildfire up there. It's communal living. Everyone's eating in the same place, using a very limited amount of, crib rooms and toilets and all that kind of stuff. And, people don't wash their hands even after COVID. People are grubs. So, germs spread pretty quick, but we isolate and we do all
See, my brand's going into strap lines, don't get the grubs, put on the scrubs.
Yeah,
or,
yeah. Honestly, I know. And I'm like, but you see it. You see people just walk in and I'm like, you have not washed your hands and you're about to eat. And I'm like, well, wash mine and hope for the best. But, and then it's like health and safety as well. So, health monitoring. Rio's doing a big push for that. I think all of mining probably is because, it is really remote work and, it is predominantly men of a certain age and, they are at risk for stuff. Also, like there's still a lot of people smoke and, it is not every job is particularly active. So, there needs to be more. Yeah, there's health monitoring that they're doing, which is good. But, also any like medical emergencies that happen or any fire or rescue or that kind of stuff, we're all involved in all of that. So, it's quite diverse and, injuries and stuff like assessing limbs and then referrals and all of that. It's been interesting. It's nowhere near as fast-paced as ED, as you would expect. You'd be worried if it was.
But I imagine it's quite a transition going from inner city London to rural Australia.
Which is what I wanted, in all honesty. Yeah, I didn't want – I love London and I miss it every day and I loved where I was working and all of that kind of stuff. And I didn't want to go from living, in a big city, working in a central London hospital to living in Perth, working in a central Perth hospital. I was like, I wanted something completely different, something that I couldn't compare, that I couldn't be like, oh, well, in London it's that way. Or like, oh, London we would, I wanted something completely different. I wanted to – just a complete change. And my family's done a bit of mining and so I was like, tick that box. And it's also a good way to save money when I've come back from London because it's very expensive there. So, I wanted a bit of a change and do something different and, I guess add another string to my bow. It's kind of made me like realise I'm like, actually I'm pretty good at primary assessments, and I am pretty, and like, and be like, I didn't, just stuff. I've learnt more than I thought I would, but it's also kind of solidified my knowledge as well, which has been really good. So, it's been interesting. Yeah, it's been really interesting.
And do you have a sense of what you want to do next? Yeah,
so I will start doing some travel nursing soon as well. So just get back into clinical. I do miss the hospital. This has been really interesting and I'm really glad I've done it, but it's kind of run its course. I didn't go into this thinking this would be my career plan or, all this. It was just I wanted a kind of system break, while moving home to try something different. And then, I miss clinical. But it's been good in the sense that I never, my mum's very ambitious for us all. And she's always like, like nurse practitioner, I think you'd be brilliant at that. I think you'd be brilliant. And I'm like, no, I like being in the cubicle. I like treating. This job's been really good in the sense that I'm like, do you know what? Actually, maybe one day that is something that I would be interested in. I never thought before that I would be, but doing, much more independent work, much more independent assessment, like see, treat, discharge, all of that kind of stuff.
I'm sure the health service would be very happy if you stay here because, we're so desperate to keep people here.
Yeah, absolutely.
So if you've got intention to stay in Australia, I think whatever you do, people will be very pleased to hear that.
Yeah, I hope so. So, I'll do some travel nursing, get back into clinical, see bits of Australia, and then, I'll get back into ED full-time next year and kind of settle down my life, I guess.
So, Emily, how can people contact you if they are on your social media and things like that?
I have an Instagram because I am a millennial. I'm not on the TikTok I'm already on too much screen time. But Instagram, if anyone wants to reach out, that's a great question. What is my handle? I think it's Emily Jane Regan, Jayne.
We'll share it.
Yeah, I know it's so bad. I'm like, how do I not know what that is? But I'm not the person who's looking it up.
Well, obviously people know how to find you anyway because they've learned how to do it. If the High Commissioner wants to find you, they will.
Now, I was at work when I first started in this role, one of the physios, one day he was like, did you win an award or something? And I was like, no. And he was like, pretty sure you were recognised for something though, weren't you? And I was like, no, I don't really know what you're talking about. And he was like, well, I Googled you. And I was like, what? You Googled me? And he was like, I Google everyone I work with. And he was like, and a lot came up for you. And I was like, oh, okay. And I kind of hate that I'm like that I can be found now and there's so much about me. But then at the same time, I'm like, well, I did put my face out there. Like, what do you expect? And this is also my own fault.
Well, we've also got your voice out here.
Yeah.
Voice out there now too.
Exactly, your voice as well. And look, we've loved having you. We've loved hearing like all those different aspects of your story in what is still a very short life. You're very young, make us feel quite ancient.
Yes. I don't always feel it. I had a patient the other day who was born in 2006. And I was like, firstly, are you even old enough to be on a mine site? And they were like, yeah. And I was like, well, I graduated high school when you were 2 years old. And they laughed and I was like, oh, I feel so old. I'm like, I think like it used to happen all the time as well, when, like at triage, and you'd be like, oh, pediatrics. And they're like, I'm 19. And you're like, oh my God, where's the time gone?
Well, look, we wish you so much joy with whatever else you do and those lucky patients who get to hear some of your stories along the way.
Thank you. This
and
has
we've
been
loved
great.
having you.
Thank you.
Emily.
We hope you've enjoyed this episode today, and we really appreciate all of our listeners, and we know that these stories of courage and resilience are really impacting on people. So if you know of someone today that you think would enjoy or gain something from this episode, please share it so that our listeners can grow and more people can be impacted.
Oh my goodness, that was so much fun talking with Emily, and I was relating to so many bits because she was talking about the coronation, and that was where I can just imagine my mother-in-law back in Scotland having tea parties and
Absolutely, there were so many people in Perth that had tea parties. Anyway, it reminded me because I was in London for the royal wedding in 2011 of Kate Middleton, who's now Princess Kate, and Prince William, and we were in Trafalgar Square, and so it was a really good spot, and we were watching it. And then a few months later, I went to the Commonwealth Heads of Government meeting, which was in Perth around then, and I met this woman, and she was from Grenada, and I said to her, I was in London for the royal wedding, and it was so exciting. And she said, yes, I was in London for the royal wedding too. And I said, oh, where did you watch it? I was in Trafalgar Square, and it was such a great atmosphere, and they had the big screens and everything. And she said, oh, I was in Westminster Abbey. And I said, oh, didn't they get married in Westminster Abbey? And she said, yes, I was an official guest because Grenada's, in the Commonwealth, and she was like from the High Commission or whatever. And it was just so funny because I thought, oh, wow, I was very impressed that she was actually there, just as Emily had lots of fans because she was at the coronation in person. Yeah, so it reminded me of that funny story.